effect. So when you have to discuss, if you discuss the risk of methyl mercury in fish during pregnancy, you have to add the effect of amalgam and the fish intake. The question is, of course, there is a factor 10 difference between exposure level here in the monkeys and what is happening in human pregnancy. Is that enough to be safe? Well, we had 100% toxic response in the monkey. How much do we need to go down to get, or what is acceptable? Can you accept 1% suboptimal brain development in the population with amalgam fillings? I don't think so. I don't know what percentage you can accept. And a factor 10 is, to me, not sufficient, far from sufficient. But there is very little evidence where we have an effect on amalgam. And what can you expect? From the animal experiments, you expect that you get a suboptimal development with suboptimal performance, but it will be probably within the normal variation, so it will be very difficult to discover. It's very similar to the lead problem. Well, I have some of the contributors to the monkey studies, colleagues at Mercury at University of Lund, and all the operant behavior studies was done by Christopher Newland from Auburn University at Alabama. Well, I thank you for your attention.
My next honor is to introduce a good friend, some 30 years, a friend of mine, Jeff Green. He said I ruined his life. He made mine a lot better, so I thank him very much. And I got him, he was my practice consultant back in the 70s, and that worked out rather well. And then along came the issue of water fluoridation, and he was back in San Diego, and I happened to introduce him to the problem, and it wasn't any time at all before he had focused on a solution, a plan, and got a congressional investigation going. He'll tell you about that, and has developed strategies that people can use in their communities to keep their water free of material that's hazardous waste, contaminated, and not good for you. I wanted to talk about how bad it was. He's going to talk to you about what to do about it. So without further ado, Jeff Green.
Part of what I'm going to do real quick, in a very quick fashion, because I have a lot shorter period of time, is to explain to you that there's also a timeline that's happened in terms of the political process that's gone on, and that there have been plenty of times in which both legally and politically this could all stop at the same time as well. I'm particularly fond of this particular picture here. If those of you who listened to David on Thursday, you'll recognize this picture. This is the U.S. Public Health Service. It's actually a slide from a movie in which the U.S. Public Health Service put out when it was attempting to sell DDT as a positive addition to our lifestyle. And what these are, if you can't picture it easily, are children who are actually eating lunch while they're being sprayed with DDT. You look at the process that's gone on. And so with all of the conversation you may have heard, especially with people making certain everybody understood that there are an awful lot of issues in which we are being inundated by what we would think are supposed to be our protective agencies not following through with it. This to me is a pure picture of just exactly how far, unfortunately, what government's willing to do to us. When people ask me, my actual topic is basically is a kind of an update on fluoridation, and I'm going to give you a couple of different aspects to it. The first one is that people ask me, where are we with this? And I tell them we've had them surrounded, but they've got all the guns. And in truth, we do have some guns left right now, but what we found is that there's a tremendous number of people who know about fluoridation and they know about the adverse effects, but in many cases, the increase is still happening where people are fluoridating and they're still adding it. And so I would suggest to you from a timeline that there's a number of things that have happened. And what I'd suggest to you that the task at hand is actually political and it's not scientific. The science has been there for a long time. For those of you who are not aware, back as far back as 1977, there was actually a hearing in Congress in which Dr. John Yamianis and Dr. Dean Burke actually appeared before Congress and were able to convince them that there was a link between a higher incidence of cancer deaths and just 1 part per million of fluoride in water. They had detractors that came in who all talked with each other, claimed they hadn't, made the same mathematical mistake and got caught in it. And so it was decided that there would actually be a toxicological study to determine once and for all whether that actually happened or not, whether there really was a correlation between cancer and fluoride. It took 13 years for the 3-year study, then came down and there was another political process that took place because the original examiners actually saw on the slides that there was cancer production that came from fluoride concentrations. And unfortunately, there was another political process that happened. Adding to that, though, right after that time period, in 1979, there was what they call a memorandum of understanding between the EPA and the FDA, in which the two of them made a determination that the FDA would only participate in foods and beverages and things that were bottled, but not necessarily in water, and that the EPA would handle what you would think as being oversight responsibilities for what we call direct water additives. What's amazing about all that is that fairly soon after that, by 1988, the actual EPA itself abandoned and actually terminated their oversight responsibility for direct water additives. How many of you believe that the EPA is the one that's supposed to be managing and monitoring what goes on with our direct water additives? Okay. Hopefully after I said that, maybe you think differently now. But in essence, one of the interesting aspects of that is that whenever you hear a discussion going on, almost everyone will say that EPA is the one that actually manages water. So if EPA doesn't manage water, who does manage water? Any answers? Excuse me? No, actually, and the interesting aspect of it is that there's so many loopholes into it that there's no government agent that actually manages the water additives. What happened was in 1988 they gave it up to oversight responsibilities to basically what we call industry self-regulation. And in the process of that industry self-regulation, guess who got to regulate it? It was actually the companies that manufacture the products that got to determine what the standards for those items were. Now, what made this work more effectively is that when the EPA gave up oversight responsibilities, that meant that the states had the determination, but the states weren't equipped to go out there and do a study on every substance that's ever used and every piece of equipment that's used in the water. So what did they do? They were sold on the idea that they should adopt this voluntary industry self-regulation, and virtually every state, there's actually 47 of them, I think, 47 states actually have the oversight responsibility for basically all direct water additives, but what they've done is they've actually adopted these standards and without any control over whether those standards are changed or adjusted or how they actually are implemented. So when we talk about who's doing it, who's actually doing the fluoridation, most people would think it's the EPA or it's the U.S. Public Health Service or it's the CDC, and it's true that they play a role in promoting it. However, the only individual, the only group, the only entity that actually can fluoridate someone is actually the water district itself. And what I would suggest to you is, despite the fact that we use the word fluoride, the word "it" creates a real problem for us, because the fluoride that most people think that we're putting in the water would typically be thought to be the water that comes in our toothpaste or mouth rinse or something like that, when in fact it's not that at all. So when we hear that someone say it does something or fluoride does something, we actually contribute to the problem. Because in essence what's happened is that there aren't any studies on the actual substance that's added in the water. So in 1998, based on the fact that we got different answers from all these different political processes as well as from their protective agencies, I was able to actually get a congressional investigation in which the House Committee on Science allowed us to pose the questions to these various protective agencies in which they had to answer back. And the interesting part is that we don't need a lot more science to be able to see what it is, and we really don't need a lot more politics in the sense of trying to figure out what's going on. What we've learned is that the EPA was able to state back to Congress that they have absolutely no studies on the long-term effects of hydrofluosilicic acid. They don't have any studies at all, period, zero. It's not ones we fight about, they just don't even have them. In addition to that, they were able to quantify, because we forced the question upon them, to quantify the number of susceptible individuals. So we have the resources to pursue something once we decide we want to act on something. And the difference is most people are still thinking we have to get those resources when in fact the congressional investigation told us these things already. So for those of you who are interested, you can always go to our website. We actually have the questions that were posed as well as the answers that come back, and that's on keepersofthewell.org. Part of our difficulty is that when we gather as much information as we have, the tendency for those of us who've learned it is to want to tell everybody everything we know. And it makes it very difficult for when we're passing on a message to someone else for that person to distinguish what they're going to pass on to someone else. And so in essence, what we have is we have a problem having to do with what we would call grassroots. When the media is not on our side, it means that we have to have a message that can go to someone else and could go fairly easily. And so what I'm talking about here is the dynamics of introducing contrary information. When you've got a subject matter that is somewhat controversial especially when in fact what you're going to do is you're going to confront the general thinking that people already have, what I would suggest to you is that people actually have filing cabinets, whether it's in their head or back in their study someplace, that this filing cabinets that they have back there have stored information already. If I immediately confront that stored information and that person goes back in their filing cabinet, there's several things that happen. One, the first part of it is they're gone while I'm talking or while I'm trying to provide information. They're looking through their filing cabinet. But it's normal for them to come back and try to test what we've done. And so in the same way, if we were talking to Boyd Haley or someone else right here, you can't just throw something at him and not expect that he would review that information and come back with information he'd seen earlier. We all go through that kind of a process. And so, unfortunately, what we've done by our messaging with the fluoride issue, with the mercury issue, with vaccine issues and the rest, we've taken a stance that we're smarter than everybody else and that we have to tell them what our answers and our solutions are, or our conclusions are, as opposed to helping them get there somehow. So in the same way that we talk in other cases, I don't know so much today as other days where we're talking about even, insulin receptors in a cell, one of the most amazing aspects is that most people, when they've taken an advocacy role, they have eliminated the understanding of receptors, of knowing, well, how do you provide something in a way that the person can grow in from the inward out as opposed to you having to stuff something down their throat. And I would take an example of the fact that when we're looking at an emotion, maybe because many of your dentists back in the old days especially, maybe many more of you were probably doing root canals. If you use the word root canal, people already go back in their head and they have a picture of it even if they've never had one before. For you to try to minimize the problem by telling them, don't worry, it's not going to hurt, don't worry, I know what I'm doing, that kind of a thing. In essence, what you've created is a jack-in-a-box kind of a thing in which, yes, you've diminished that interest at the moment, but later on somebody pushes the button and it pops right back up again. The real true answer to that is you've got to build up the interest on other sides. And so what's missing in many of our messages is that we think we have to, when we have an anti-message, that we have to attack the other side, and we have to attack it piece by piece by piece. So if somebody says this, I have to prove them to be wrong. And what I'm suggesting to you is that that's not how receptors work. That if you don't have some way for it to get in there, it's real hard for it to do. Filing cabinet, these are normal things when we talk about in management consulting, but also when we do effective advocacy courses. Simple ones: resistance to change, urge to think our own thoughts, wishful hearing, unwarranted assumptions, protection of self-choice, where we actually have habitual ways of the way we protect ourselves against other people intruding upon us individually. These are all areas that normally we would want to show someone exactly where you are, so that when we do management consulting processes, we actually teach somebody how you can tell when you're in one of these particular factors instead of truly talking and truly engage with a person from their own self-choice. I'm going to focus on anti-messaging. I'm going to try to move through real quickly because some of the people in previous meetings have heard me discuss some of that. But the first thing about anti-messaging is that it's a proof that you're out of power. Nobody that's in power has to be anti-anything. They basically just do whatever they're going to do. And so anytime that we're anti, we've actually told people that we're in the minority. And the truth is, I don't believe we're in the minority about what we do about drinking water. Next part of it is that anti-messaging always carries the proponent's message. It always carries it around. So when we look about fluoridation, it's always about children's teeth. We carry that message with us as if we have to talk about it, when in fact it's a water issue. And in fact, we're talking about two different things part of the time, but most people who get into being anti-fluoride start talking about the fluoride that's in the water and about children as opposed to the safety of water and other concerns. It carries the burden of proof. It's amazing how all of a sudden we've turned it around. So instead of somebody putting something in water having to prove that it's safe and effective, instead we try to carry the proof that it isn't safe and effective. And in fact, that's why we continue to create our own opposition. It's very easy to pick apart proof of the fact that it's not safe and effective. All you have to do is pick one piece. And especially in this case, the media determines the message based on the proponent's perspective. So you'll see this constantly in your newspapers, where they will say that this cavity preventing substance, and these people claim that it harms someone. And so you find that it's almost always referenced in the same way because people made it that way. That's how they've done it. Anti-messaging seldom addresses the issues that are the core of the desirability for the proponent's message in the first place. And I'll take the idea of vaccinations. There's a reason why people are vulnerable to vaccinations. Children are, because they want to do the best for their child. So sometimes what happens is we're trying to tell them that they shouldn't be vaccinating. That didn't resolve the issue about what do they do for their child. So sometimes our anti-messaging misses the point from the very target group that we're trying to deal with. And unfortunately, that's why we're less effective, even though we are, quote, right about some of these things. It seldom allows the reasoning to support the audience fallacious position, and that's a big word way of saying basically, they got that information from somewhere, and whether they're pro-fluoride or pro-mercury or pro-amalgam or pro-vaccination, they got there somehow or other. And most of the time when we're anti-something, we basically accuse them of being stupid, being dumb, being wrong, all these other kind of things. We put them in a position that basically we've drawn a line. We put them on the other side, and in fact don't give any room to get to where we want them to go. And so without allowing for the fact that of course they should be thinking those things, they've been inundated with information that said it was all great. Without those kind of introductions to it, we're actually slapping them in the face and telling them, well, why don't you listen to me? Positive messaging provides perspective before the conclusion. So we found that when I'm on a radio program, the same way that David might be in, we have a host that basically would tell us, who in essence is what they would call anti-fluoride or anti-mercury or something else. And one of the first things that they want to talk about is, Jeff, tell everybody just exactly how bad fluoride is. Well, I already know that audience can't hear me already once I start in that. That if I don't provide perspective about all of the different uses for fluoride, not because they're all harmful to us, but if I don't provide perspective so that they can see what the nature of fluorine and fluoride is and how large of a role it plays in our whole life, and give it some credibility in terms of what the element really is. In essence, what I do is I'm asking someone I'm doing the same thing that the other proponents do. I'm omitting major factors that make a difference as to how they're going to perceive this. If I don't explain to them the fact that it's available and from all these other sources, and if I don't identify actual foods, my saying that it's in foods and beverages does not what we call travel. And for some of you who've heard me before, what we've said is that if you're going to have a grassroots message has got some rules. And a grassroots message basically means that it has to go from the fourth to the fifth person to have enough numbers to be effective. And it's got to go there without paper, and it's got to go there without what we call elite knowledge, meaning that you've got to touch one of those receptors some way for somebody to understand the message and pass it on. Positive messaging always conjures up positive pictures. I want you to think about all the messages that you've seen for anti-mercury or anti-fluoride or anti-vaccine. How many smiling people do you see in those? How many sexy pictures do you see? How do you think, where's the benefit in being able to be in that kind of a situation when, in fact, almost everything we're doing is negative and the pictures look like that? If we were going to try to describe what safe drinking water was, which is in the positive framework, what would it be? How do we depict safe? Okay, it's pretty amazing when you start thinking about it because most people don't understand, well, what's the picture for that? Well, safe is enjoyment. Safe is it's a child, who's playing for 45 minutes in a bathtub. It's a child or kids that are teenagers that are squirting each other with a water hose while they wash something. It's cupping the water and having it come all over your face and so forth. But they're pictures of enjoyment which allow someone to feel that you have the freedom and that you don't feel that you have to worry about it somehow. And we don't see those in typically what we would call anti-messaging, whether it's for vaccine or mercury or any of the rest of those. Another aspect of this positive messaging is recognize who holds the power to decide. And I have to suggest to you that when we talk about power to decide, when we're dealing with patients, it is the patient that gets to decide. When we're dealing with children, then it is the parent. And if we don't create messages that allow them to come to their conclusion instead of us trying to tell them what their conclusion should be, it doesn't sustain and it's not carried forward. And it also has to do with, well, how much energy are we going to put into being anti-something if we're not really addressing something that's going to change the landscape somehow or other. More information is not necessarily more persuasive. In fact, what happens is, one of my concerns is that when we go into a community, the closer and closer you come to someone voting, the narrower and narrower and narrower the message has to be. That if you give someone 50 reasons, and I mean that not negatively in terms of that, but nobody has the time to be able to absorb 50 reasons at that point, and all you have to do is to find one for somebody to slip out of it. What we found is that there are It's really more the questions that we ask. In fact, if we can put it in the hands of a champion that's willing to work with us, from either a city council person or a legislator or someone else who has authority or has power, their questions are more important than us standing in front of them and giving them the answers, because they can actually pierce the other person's credibility by doing that. Here's a question. Here's a statement. Please deliver one single toxicological study on the long-term effects of the actual substance used. We don't have to have 10,000 studies. All you got to do is just show us one. And all the rest of the time that people spend trying to fight about whether fluoride's good or bad and all the rest of the studies on there, then it doesn't mean anything, because they're only putting one substance in your water, and they're putting it in your water, and it comes in a form. And so we think that the second question is, instead of all of this work that people go through, is will the chemical supplier provide a statement that their product fulfills the legislative intent of safely and effectively reducing tooth decay at the full range of consumption? That's what it's being put in the water for. Can they produce a study or a statement? Well, they willing to take on the liability, and what we know is that they won't. And so there's action that we're taking that is that simple, that comes down to the fact that says, I mean, they're putting something in the water, what's showing up in the truck. We don't have to say, well, how many 2,000 studies, and what did this people say and those people say? This is the substance, let's see it on that. So part of our proactive tools is to provide public policy solutions. And I'll move to this real quick because of time. A couple of quick ones for the fact, the ones that you can participate immediately on, and ones that don't happen in most of these city council processes when people decide to fluoridate. First one is remove the vending machines from the hallways, and obviously you've had a lot of education about the value in that you got to get rid of the fermentable carbohydrates that they're letting them stand in their mouth for all day long. It isn't a matter that they can't drink these items or eat these items any longer, but if they're there, basically hanging out all day long, you're going to have higher tooth decay. Second part of that is just making certain that they rinse their mouth. I mean, even that can have a high impact on whether or not people basically have more tooth decay. Supply toothbrushes for after lunch. Giving you what I think is an easy one for you, because basically you can buy the kind of bass toothbrushes that David and other people talked about earlier for dry brushing technique. You put up $100,000 in a city, even if you buy it just at the non-economical rate of $5 for $1, the way that David and I, if we had with their own wrapping and even names on them and so forth, that's 500,000 toothbrushes that could be handed out in those school programs that could be given right after lunch. And I have a hard time believing that the dentists that sit here don't think that that's a more effective way. If you can teach children how to brush their teeth, play with a toothbrush, certainly could be done in a dry brushing technique. Third part of it is introduce information in prenatal care. And that could be true for vaccinations. It could be done for the others. When I go back to what's an answer for vaccinations, remember, despite the fact that maybe they shouldn't be taking, we believe that they shouldn't be taking the vaccinations, who's telling them how to develop an immune system for a child? Without providing some of that information, what are they left with? It's a no or none is the process. Our power. We've got certain power processes available to us. One of them is to require representation. The courts basically back in 1990, 3 different court situations, one 11 days, one 14 days, and one 40 days of expert witness testimony, already made a determination. These have never been overturned. The merits have never been overturned. They came down to 3 distinct things. One, that fluoride at 1 part per million in the water aggravated existing illnesses. 2, that they caused adverse health effects. And 3, that they were linked to higher incidence of cancer deaths. So what our difficulty comes down to is, even though we've shown this right here, is that what happens is that it's our legislative bodies, our representative bodies like city councils and the rest, that are making determination. And the court's reaction to all of this as far back as 1953 is, you've got 3 things available to you. Get them to change their mind, throw the bums out, that's my words obviously, throw the bums out, or do an initiative, do your own legislative process. And so we have the ability to initiate and enact legislation, and we've done that. And for anybody who has an interest in that, that's what I'm trying to encourage across the entire United States, to be proactively putting something that never even uses the word fluoride, but has to do with water. And I would raise my hand and say to you immediately that if you're expecting everybody to be anti-fluoride to resolve this issue, I think that you're missing the whole boat. We already have the majority of people who believe in safe drinking water. We're trying to convert them into having an anti-negative approach to something, when in fact, they'll want safe drinking water. Why are we having to convert them to something else before we resolve our problem? And then the next part is to require adherence to law. And I'll describe 2 things to you. One of them is the fact that right now I'm speaking to people all across the United States about going after water districts that are not following the law in terms of state laws that compel them to basically comply with a standard that's created by NSF Standard 60. Through our congressional investigation, we found that not one chemical supplier in the entire United States has followed through and is in compliance with what virtually 47 states says is law. And so we've gone after it in a fairly narrow way to begin with, where we actually provide constructive notice. We basically tell them, hey, here's the law. 2, we've got evidence that the law is not being followed through with. 3, we believe that you have a duty to pursue this and to review this, to do your own due diligence. 4, cease and desist. That's the law. Stop. And probably just as importantly, a little zinger in there that basically says, oh, by the way, if you don't inform all your auditors that this risk is there right now because if you're not following the law, then you yourself don't have the protections any longer from working for the government. That you can work for the government, but you don't get to break the law when you're working for the government. So we're asking people to participate with that. We are actually, proactively going after statements that are made by dentists, health professionals, other people who have licenses in which they make what we would consider to be factual false statements. Factually false is different than conclusionary false, but in which they stand up and tell you you'd have to drink 660 liters of water a day in order for you to ever have any adverse effects. To say that there's no peer-reviewed studies that have ever shown at 1 part per million that there could be any adverse effects. Those are flat-out false misrepresentations. For those of you, this is an area you need to look at for other things that you speak about. The professional licenses almost always have a ethics section or an advertising section that requires that 3 things: that you cannot use the credibility of your profession in conjunction with a false, either knowingly or in most states it's also with reasonable care should have known, while you're trying to sell a product. Well, the product is, in most cases, hydrofluosilicic acid. So we've successfully gone after people, had them, we usually do a request for retraction, in which we've successfully gone after individuals in which it has made a major difference as to what professionals are willing to do anymore when all of a sudden their income's on the line. And although nobody's had their license taken away, and there are fines and they can do that, we found that it's had a very chilling effect for someone to just randomly go up there and say, oh yeah, I heard this from someone else. So these endorsements of endorsements, especially when you get into specific statements, usually slides away. So we've been much more effective on that. I'd have to end this with the fact that in my mind, you are the face of your profession. Whether you're a scientist, I'm sorry, whoever's talking to you, you are science to them. If you're a dentist, you are dentistry to them. And so in the past, I've always asked people to raise their hands if they live in a fluoridated community. I've always asked people to raise their hands and say to what degree that they don't want to be in a fluoridated community anymore, either because it's not there. And virtually everybody has raised their hand to both of those. The real question is, to what degree are people actually acting? And so what I'm asking you to do is either act with us, because that's what we do. We show people how to do it where you don't have to sacrifice your license. You don't have to take your life like it's done, David did to me, but at the same time, we have methods, we actually have strategies, and we win when we're following the strategies. It takes some work. It doesn't always take your work. In some cases, it's just you helping us expand further outward. So either act with us, act on your own, but be proactive one way or the other. Here's my telephone number, basically website so that you can go and you can communicate with me if you have an interest. Thank you.